I'm Callie Wise, Director of Service Delivery Improvement with the National Family Planning and Reproductive Health Association, also known as NIFRA. NIFRA is a nonpartisan, nonprofit membership association whose mission is to advance and elevate the importance of family planning in our nation's healthcare system. Telehealth, the delivery of health care, health education, and health information services via remote technologies, has been gradually on the rise for years, especially in rural areas and for specialty care. In 2020, in response to COVID-19, we saw a surge in the use of telehealth across the entire healthcare sector and in all geographic areas, thanks to a number of waivers that facilitated expanded use of telehealth. While some family planning providers have been offering telehealth for a while now, overall, the use of telehealth for family planning care prior to the pandemic was relatively low, in part because providers offering telehealth didn't receive adequate reimbursement. But to continue to meet patients' needs during the public health crisis, family planning and sexual health care providers, like so many others, very quickly implemented telehealth to ensure access to important care. This has presented both incredible opportunities and unique challenges. We're now largely seeing healthcare and reimbursement policies trending toward being more supportive of continued and expanded use of telehealth. So as we look to the future, we have to examine how telehealth fits into models of patient-centered care. And let's be honest, telehealth isn't perfect. We are just at the beginning of a journey to determine when and how it offers the most value to patients. In the context of family planning, it does offer us a chance to increase access to contraceptive care and to meet patients' needs in new ways that support patient autonomy and that offer more choice to patients in how they receive care. In this video, you'll be hearing from experts in the field about the benefits of telehealth, how it can support patient-centered contraceptive care, practical tips for initiating use of telehealth, tips specifically for phone visits, and strategies for providing education without your usual tools. We hope you find these insights useful. Enjoy.
I think what I like the most about it is I have such a strong commitment to patient-centered care. I do believe it creates a much more even playing field and creates equity across numerous communities that where otherwise there were very different kinds of barriers to access to care. And so the fact that telehealth really puts the locus of control back to the patient, improving their autonomy, their ability to make their own decisions about where they do that appointment, who they have in their space when they do that appointment, I think has made a really big difference.
When I first started doing telehealth visits, I was worried that clients would not be as engaged and not as forthcoming with their information because we were separated obviously by distance, and then we're talking to each other on this little screen. And I've been really surprised and pleased at how quickly clients have adapted to this.
There is flexibility in telehealth, but there can also be limitations in terms of whether or not this is what the patient needs, right? So sometimes patients need to come in and they need to be in the same physical space with their provider to feel like they can trust that provider, to feel like there's really good communication. For some people who are in situations, I'll just give one example of a person who may be in, an intimate partner violence situation, whose partner is frequently monitoring their calls or sort of listening to what they're saying. The time that they get to be away from that partner may be only when they say, I'm going in for, my yearly physical or my exam or, sort of whatever it is that they tell their partner.
A lot of folks are still concerned about having people in their homes, about access to what's going on in their kitchens, to see if they're going to call Child Protective Services. And so The patients are really, and the birthing people and the doulas, although they're excited about the expansion and the opportunity that they could have, they really want us also to ensure that it's not used for policing and for harm. For many people, especially communities of color, for women, there have been multiple instances where the healthcare field has not, or the healthcare systems have not been very kind. They've been traumatized. They've been not heard before, not listened to, blamed, or shamed. So they're not super excited about coming in to see us at an appointment. And we don't make it convenient for them. We tell them to drive downtown, take 3 buses, miss work. We don't allow children in the rooms. We don't allow children in the waiting rooms. We don't allow people to bring family members, or they can't have food. So all of these rules and restrictions we've been putting on patients, besides the fact that historical trauma for communities of color, the history and the legacy of J. Marion Sims, the history and legacy of white supremacy culture inside of reproductive health, makes people not really want to just come to the doctor all the time. So this is also, telehealth gives us an opportunity to say, hey, I know that, I understand that. Sometimes it's coming into a building that you might have had a baby or a bad experience here, and you don't really want to come here anymore. We'll come to you. We'll make opportunities to make sure that you receive the care that you deserve in the place that you feel safe and valued.
My patients come from a wide geographic region, including rural areas, and providing telehealth has really facilitated their ability to access care without having to travel long distances. A lot of the care, including contraceptive care, can be done over the phone without necessarily losing quality. So from an access standpoint, telehealth has been quite beneficial for my patients. They don't have to necessarily take off work or find childcare, which are huge barriers to timely health care.
Just recently, I did a video conference with a patient who lives on the Arizona-New Mexico border, which is about 140 miles away from me. Very complex medical history, and doing the video conference allowed us to break up her issues into 3 or 4 different visits without the pressure of thinking, transportation, logistics of getting all the way to Albuquerque.
I think there are also some indicators suggesting greater efficiency of care for the provider and the healthcare system. Because the visits tend to be more targeted, they seem to be more predictable in terms of time. So when patients log in, they can expect the clinician should be there relatively soon. I think as the data come in, we will learn a lot more about whether this efficiency is accomplished without compromising quality of care.
It gives me more time. So working in, primary care in America, right, where there's just a lot of demands on your time and sort of on the visit, right? And so for me, what's really nice about doing telehealth is that the visit starts when it starts, and there's no extra pre-stuff, that we have to impose upon the patient.
One of the changes that I've seen with telehealth visits is that for the most part, you're seeing a patient, or you're talking to a patient, or video conferencing with a patient for the entire duration of their visit. And I do believe that slows the cadence down a little bit, allows for more open-ended questions. Even though you may still have in the back of your head, I have 2 patients waiting, at least for me, I'm not worried that they're sitting in an exam room with a sheet on. I'm thinking they're at home, they're probably going to be more comfortable.
The content and structure of patient-centered counseling itself doesn't change. That is, the what doesn't change. We're still using the same principles of evidence-based care, best practices, many of which are included in the QFP. But what has changed is the how, and the way in which we connect and communicate. So in some ways, it's a bit more informal, which is nice. I get to see their home environment. They often see mine. And I think for a very personal and intimate topic area, like contraception and sexual health is, I think this informality can actually help to build rapport.
I have found that I can listen just as well. I can read people's expressions and body language. And I can use my voice to communicate the same way and listen the same that I do in person.
The option to have 1 or 2 or 3 phone or video conference visits and then consolidate what needs to be in person, like inserting a long-acting reversible contraceptive in a patient who otherwise has a lot of complex medical problems, is very empowering for patients.
We, like many clinics, unfortunately, have not been able to accomplish same-day visits for IUDs or implants. But this approach, that is having a telemedicine approach, would at least preclude the necessity of 2 in-person trips, which would be a huge boon, especially for our patients who have to travel long distances.
I recently had a patient who actually lived near the Texas border who wanted a long-acting reversible contraceptive method. And she decided on an initial video conference visit because it was going to be very difficult for her to get transportation. She had numerous insurance barriers to being able to access care. We did a video conference visit, and in our exploration of different contraceptive methods, she ultimately decided on a short-acting method and was able to avoid an in-person visit altogether, which for her was very empowering and really allowed her to exercise her autonomy and her ability to make a decision.
Telehealth gives us an opportunity to really say, hey, I'm going to meet you where you are. I'm going to provide care to you any way that you want. So if you want to come in, you can have care. If you want to receive it through the telephone, you can. If you want to have it through a video. But I trust that you are making the choices that are best for you and your family, and that you need to receive the care that makes you feel most safe and most heard and most valued.
I think that either doing a telehealth visit that's virtual, or even one that is audio, certainly provides a layer of protection for the patient in terms of not being coerced to use something that they actually really don't want to use. If they are virtual or they're on the phone, then they have that protection of, okay, I don't have to do this today, actually, and I can think about it and I can say no. And maybe I want to say no over the phone, or via virtual visit instead of in person, because I feel more comfortable. The really important benefits of telehealth for teens in particular have to do with both confidentiality and then just their ability to get to an office. For teens, they often want to have confidential spaces and may not be able to do that if they have to come to the office with their parents or with their guardians or another adult. So telehealth, I think, provides that also, so we can get them on the phone at a time that they say is the most convenient for them and when they know that they'll have privacy.
Confidentiality is so important in the work that we do. So I think it's really important to establish that baseline that confidentiality is important to me. And I want you to know that I'm in a private room and I use headphones so that I can hear the conversation better, but there are no recording devices or anything like that.
I let them know that I'm the only one on the call and that I'm in a space that is quiet and private. And I ask them if they're in a space where they feel comfortable sharing with me and talking with me. And we sort of go from there, right? So if they don't, then we adjust. We either say, okay, should we talk at another time? Or we say, let's talk in terms of yes, no questions.
We have a standard statement through our health system to identify the patient through 2 identifiers to ensure that the patient understands that the conversation is secure and confidential, that the interview, whether it's by phone or by video conference, is in a room with a closed door without access to other people. I also talk to the patient about their level of comfort with their own surroundings and if they feel that this is a good situation for them to talk. And I have found that a number of patients will bring a partner or a friend not unlike they would bring to an in-person visit.
When patients are not in spaces that seem to me like they're ideal to have conversations about healthcare, reproductive healthcare, contraception care. I think I ask the patient, right? Like, are you in a space where you feel like you can talk and you feel comfortable? Sometimes patients are riding the bus, they're driving to work, they're walking to work, they're in the checkout line to a grocery store, and sometimes they say, yeah, I can talk now. Or sometimes they say, I actually gotta talk right now because this is the only time that I have to talk, so let's do that. There's patient-centered care, and then there's also sort of like patient-led care. So you can ask the patient what they need, and in most cases they will tell you what they need. If a patient says to me, hey, I really can't talk right now, or I can't say a lot right now, but I still need to talk to you, then we can sort of adjust. And or I can say, okay, well, I can ask you yes, no questions, and will that work for you? And I think that way, we can have conversations with patients that are confidential, even when they're in spaces that are not in and of themselves confidential.
If a patient wants to talk in a checkout line at the store, that's their prerogative, and that they can make their own best decisions about who can hear their concerns or their whatever they want to voice on the phone. And I don't worry too much about who they allow to be a part of the clinic visit. After verifying, of course, that they are comfortable with where they're at and who is present.
I think at first, just discomfort in not feeling like I was in control of my interaction because I was paying so much attention to the technology. My tip would be just be humble and be transparent. If you're not that familiar with the technology, or a new experience for me recently was working with an interpreter virtually, I think the best plan is to just be honest with your client. I've been doing telehealth visits for the past month, but I will admit that I'm not totally comfortable with this technology today. It's new to me. So if there are things that are not as smooth as either one of us would like, I'm sorry. And I welcome your feedback at the end of the visit to let me know how we could make it better next time.
In terms of the logistics of the clinics themselves, I do find that having a half day that is either all virtual visits or all in-person visits is easier to handle just from the logistics standpoint. It's critical, I believe, to ensure that the clinicians and the scheduling staff have conversations about the difference between phone visits and video conference visits from in-person visits. Whenever you start something new, there is a learning curve. And so scheduling fewer patients as you're getting used to a new technology, even if it's the phone, which is not a particularly new technology, but it's new for most providers to do visits over the phone. So ensuring that there is adequate time, that the provider doesn't have a bad experience on the first day or two or three, because patients are always going to be in a better place if they've got a provider who's feeling good about how things are going with the technology. It gets down to change management and getting our staff excited about the advantages of telehealth and this different way of seeing patients was critical for them to have the motivation to then help patients be able to utilize really both telephone and video conferencing.
Doing things like situating your camera on whatever device you're using so that the client feels like they have direct eye contact with you. I know sometimes it's easy to, be to the side even, or have the camera so that you're halfway cut off, or that it's looking at more of your environment than you. So being very intentional about the way that you place your screen and where your webcam is going to hit you, I think is very, very important to make that constant connection with the client. One of the big things that I've had to really work on is narrating what I'm doing while I'm on camera, because again, when you're face to face, you're used to maybe reaching over for something or doing something. But when you're on camera or looking at another screen, I might be looking at a resource like an app on my phone related to what we're talking about. And when the client is there with you, they can see that you're still attending to them, but you're trying to get additional information, or you're recording something that they said in the chart. I have had to just really be conscious of any time I change and I don't have that eye contact with the client, you just have to narrate exactly what you're doing. Let me take just a moment and get to the chart. I want to see what that last lab was that we were talking about, instead of just turning away and doing it. I've been talking to clients on the phone about problems and doing problem solving with them on the phone for many, many years. This feels different when you're doing a quote clinical encounter and you're doing the whole chart and all of that. This just feels different to me.
I think it's important to provide access to audio visits. Wi-Fi is, available for some and not for others. Audio visits also can be more confidential. It's harder to develop rapport, but it can be done. And, the same skills that you use to develop rapport when you're, looking at a patient, right, in terms of what you say and how you say it and your ability to listen, those things still apply in an audio visit as well. When you cannot see a patient, saying to that patient, hey, here's where I am. I'm in a confidential space. I know you can't see me. I'm going to, check for understanding by asking you, a few more questions than I normally would, because I can't see you. And sometimes I might not be able to hear you very clearly. So, I'm sorry if I'm asking you questions, multiple times. What's different in an audio visit might be, sort of, if you're talking to a patient and trying to describe what something looks like, right? Whether it's the ring or it's an IUD or it's an implant, now you have to be a little bit more creative about, facilitating for people being able to see those things.
When I do video conferencing visits, I share screen all the time. I think Teachbacks is very useful. And there's no question that it's a little bit easier to preface it by saying, I want to make sure that that we have the same, that you have the same understanding that you would if you were here in the clinic. Please let me know how you would use the birth control pill. What would you do if you had a missed pill? Just to ensure that I've been clear with you about the information that I've given you.
It's very easy for us to send them links. There's email, we can text them links. We have an EMR patient portal, so we can send it through that as well. Links to websites that, that I think are really accurate and that are really patient focused and patient friendly. And then there are other ways that we can get patients what they need in terms of written materials. If they don't have access to the internet, if we can't send them links, we can always send them actual hard copies of decision aids and tools that are really focused on their options.
The usability is different across different platforms. But people have certainly gotten more facile with sharing screens. So you can have some of these visual aids ready and then share your screen. We also have an email communication in our system through a secure platform. So I can send materials or links to my patients, and then we can continue the conversation that way. I think what's nice about this is that it's all on the patient's own terms.
I mean, I would just say, jump in. It is such a great way to provide care.
We have in a very short time overcome a lot of the technological and regulatory issues around telemedicine. I would love to see us continue to leverage telemedicine to its fullest potential to really improve access, as well as the efficiency, timeliness, and quality of contraceptive care on a national level.
Telehealth is an important avenue for people to get what they need in general, and certainly contraceptive care is no different. If we want to take a really hard look at the evidence and the literature, what we know is that, there are very few instances in which an actual physical exam is needed in order to provide the patient what they need. So if seeing a patient face to face, because a physical exam has to be done, prior to starting a method is the reason why somebody isn't doing contraceptive care via telehealth, I would, say maybe go back to the literature and take a look and also be reassured that that's actually not necessary. And, this idea of like, well, we have to trust patients that, they're not pregnant when they say they're not pregnant, that they're not having sex when they say they're not, that they know what their period is. Yeah, we have to do that. We probably should be doing that anyway. And that, instead of sort of making this a patient focused thing and saying like, this is about trusting the patient, it's really, it's really about letting go actually of some of this paternalism and control that we have been trained over time to think that we need, and to think that we are the experts at, when really patients are the experts at what they need.
For years, we've been lobbying and asking and requesting and educating our legislators around the importance of access to broadband and telehealth for rural communities, for non-centered communities, for Black, Brown, and Indigenous communities, and we couldn't get any traction. So I'm a Katrina survivor, and so out of tragedy, there's often disruption and you can get change. So we have an opportunity. Now we see people can and do like telehealth. We can have free broadband. We can improve access if we trust and value patients. And so we don't have to get so nervous if they're going to be doing their own blood pressures or weighing themselves or doing their own pregnancy tests, that we can value them and trust them that they're doing what's best and they're not going to do things that are harmful. And telehealth is a way for us to get care to people who need it.
Family planning providers have always innovated. Overwhelmingly, we've seen over the past, 50 years that family planning providers do that. We think that healthcare and reproductive healthcare particularly is essential. So if we can deliver it in a better way, I think we've done that. And so I see this as just a natural evolution of what family planning providers do. They believe that sexual and reproductive health care is essential. And if there's a better way to do it and there's innovation, why not?